Hello everyone. Today we are going to revise the topic level of prevention and role of nurse in psychiatry. So let me tell you the first meaning. What is level of prevention? What is prevention? So prevention in psychiatry is the reduction of mental disorders and behavior problems by identifying risk and protective factors and applying evidence-based interventions. So that is level of prevention in psychiatry. This is the meaning. So what happens when in level of prevention, mental disorders, prevention, and our aim in that is to reducing incident, prevalence, reoccurrence of mental disorder and the time spent with symptoms or the risk conditions for mental illness, preventing or delaying reoccurrence, and also decreasing the impact of illness in the affected person and their families and also in the society. So this was the introduction of level of prevention. Now let's start. So in the 1960s, psychiatrist Gerald Kaplan described level of prevention specific to psychiatry. He described primary prevention as an effort directed towards reducing the incidence of mental disorder in the community. Secondary prevention refers to decreasing the duration of the disorder, and tertiary prevention refers to reducing the level of impairment. Here we can see that in mental health, ability to cope with activities of daily living in adaptive manner comes in primary prevention, and which leads to health maintenance and specific protection of vulnerable population, and mental illness and inability to adapt comes to secondary and tertiary prevention. In that we need to do early diagnosis and prompt treatment and rehabilitation. So let's see in details one by one. Primary prevention. So primary prevention seeks to prevent the occurrence of mental disorder by strengthening individual, family and group coping abilities. Now, what is the role of nurse in primary prevention? So, in community mental health, nurse are in a key position to identify individual, family and group needs, conflicts and stressors. Thus, they play a major role in identifying high-risk groups and preventing the occurrence of mental illness in them. Some interventions, which includes individual-centered interventions, like what we need to find in individual. So, antenatal care to the mother and educating her regarding the adverse effect of irradiation, certain drugs, and prematurity. Next one is ensuring timely and efficient obstetrical assistance to guard against the illness effect of anorexia and injury to the newborn at the birth. So during antenatal care, we need to educate the mother, and whenever it's needed, obstetrical assistance is important. Next one is dietary corrections to those infants suffering from metabolic disorder, correction of endocrine disorder, liberalization of laws regarding termination of pregnancy when it is unwanted, training programs for physically and mentally handicapped children like blind, deaf, mute and mentally subnormal, etc. We need to train who is physically or mentally handicapped, like who is deaf and dumb and mute. Counseling the parents of physically and mentally handicapped children with particular reference to the nature of defects. The parents need to accept the child and emotionally support the child and be satisfied with limited goals in the field of achievement. Next one is fostering bonding behaviors, and that we need to explain the importance of warm, accepting, intimate relationships and avoiding the prolonged separation of mother and child are essential. Second one is interventions oriented to the child in the school. The first one was individual-centered intervention, and the second one is interventions oriented to the child in the school. So, in teaching growth and development to parents and teacher is important. Identifying the problems of scholastic performance and emotional disturbances among school children and giving timely interventions. School teacher can taught to recognize the beginning symptoms of problem and referring to appropriate agencies. Now the third one is family-centered interventions to ensure harmonious relationship. In that, we need to counsel the parents about appropriate disciplinary measures. We need to promote open health communication in the families, rendering crisis counseling to the parents of physically and mentally handicapped children, and ensuring harmonious relationships among members of the family and teaching healthy adaptive techniques at the time of stress-producing events. Fourth one is interventions oriented to keep families intact. In that, extending mental health education services at Child Guidance Clinic about child rearing practice at Parents-Teacher Association regarding the child relationship between teacher, child and parents, and at various extramural health agencies regarding integration of mental health into great general health practice. Strengthening social support for the frustrated aged and helping them to retain their usefulness. Then we need to promote educational services in the field of mental health and mental hygiene, and developing parent-teacher association, rendering homemaker service when there is absence of mother from home due to illness or other reasons for prolonged periods. The public health nurse can arrange for the service, and providing marital counseling for those having marital problems. Fifth one is interventions for family in crisis. In developmental crisis situation such as child passing through adolescence, birth of a new baby, retirement or menopause, death of a wage earner in the family, desertion by the spouse, etc. In crisis interventions, in what situations we can give, we can refer, a crisis intervention can be given at mental health clinic, at what place we can give crisis interventions, and psychiatric first aid centers and walk-in clinics. Sixth one is mental health education, conducts mass health education programs through films, shows, flashcards and appropriate audiovisual aids regarding prevention of mental illness and promotion of mental health in the community. Then educate health workers regarding prevention of mental illness so that they can function effectively in all the areas of the prevention. And the last one is 7, society-centered preventive measures. In that, community development, like culturally deprived families need biological and psychological supplies. They need better hygienic living conditions, proper food, education, health facilities, and recreational facilities. Otherwise, psychopathy, alcoholism, drug addiction, crime, mental illness will result in such situations. Collection and evaluation of epidemiological biostatistical data. So, in primary prevention, we have seen individual-centered intervention, intervention oriented to the child in the school, then family-centered interventions to ensure harmonious relationship, then interventions oriented to keep families intact, then interventions for families in crisis, and mental health education and society-centered preventive measures. Now we are going to see secondary prevention. So what is secondary prevention? As I told you in the introduction, secondary prevention targets people who shows early symptoms of mental health disruptions but regain premorbid level of functioning through aggressive treatment. So we will be seeing role of nurse in that secondary prevention. Early diagnosis and case finding. This can be achieved by educating the public, community leaders, industrialists, Mahila Mandals, and Balwadi workers, etc. in how to recognize early symptoms of mental illness. We can teach all these members like how they can recognize mental illness, case findings through screening and periodic examination of population at risk, monitoring of clients, etc. So, in clinics, schools, home, healthcare, and the workplace, community mental health nurse detect early signs of increased level of anxiety, decreased ability to cope with stress, and failure to perceive stress. The environment, reality, and provide direct early reference is there. In early reference, the public should be educated to refer these cases to proper hospitals as soon as they recognize early symptoms of mental illness. That is called early reference. Now, what is screening program? So, screening program is a simple questionnaire should be developed and to identify the symptoms of mental illness and administration of the same in the community for early identification of the cases we do. This questionnaire can be simplified in local language. It has to be in local language and used in the colleges, school and industries for early screening. Then early and effective treatment. In early and effective treatment for the patient, we family members as relatives, and we need to provide counseling for early and effective treatment for the patient. To whom we can counsel family members, we can counsel caregiver of mentally ill patients. Next one is training of health personnel. So orientation courses which we can provide to health workers to detect cases in the course of their routine work. And then consultation services. Nurses working in general hospitals may come across various conditions such as puerperal psychosis, anxiety state, septic ulcer, ulcerative colitis, bronchial asthma, and many other diseases. These basic care providers need guidance and consultation to deal with this condition in the effective manner. And last one is crisis intervention. In that, we tackle crisis in this. What happens if crisis is not tackled at timely, then it may lead to suicide or mental disorder, and sometimes anticipating the crisis situation and guiding the individual in time can help them to cope with crisis situations in a better way. So this was about secondary preventions. Now let's move towards tertiary prevention and tertiary preventions. Tertiary prevention targets those with mental illness and helps to reduce the severity, discomfort and disability associated with their illness. In this term, community mental health nurse play a vital role in monitoring the progress of discharged patients in halfway home and their houses, especially with regard to their medication regimen and coordination of care. So, what will be the role of nurse in tertiary prevention? The first one is family members should be involved actively in the treatment program so that effective follow-up can be ensured. Occupational and recreational activities should be organized in the hospital so that any other happening is prevented. Community-based program can be launched through meeting with the family members when the need for discharge from the hospital should be emphasized. These programs can be implemented through day hospitals, night hospitals, aftercare clinics, halfway homes, ex-patient hostels, foster care homes, etc. And follow-up care can be handled over the community health nurses. Then there should be constant communication between community health nurse and the mental health institution regarding the follow-up of the discharged patient. The ultimate aim of the hospital and community-based program is to re-socialize and re-motivate the patient for a functional role in the community consistent with his resources. There are a wide range of services that need to be provided to patients as a part of tertiary prevention program, and nurses need to be familiar with the agencies in the community that provide these services. Collaborative relationships between mental health care providers and community agencies are absolutely essential if rehabilitation is to succeed. And an important intervention in the maintenance of patients in their own homes in the community is the training in community living, which is called TCL program, designed by Stein and Fest. In this model, when a person is referred to a hospital admission, the staff goes to the community with him rather than is going to the hospital to be with the staff. The real world experience with the patient enables the nurse to assess accurately the skills that the person needs to learn and to mutually agree on the realistic goals. Another aspect of community life that is more difficult to assess accurately and deal with effectively is the stigma attached to mental illness. Many patients and their families try to avoid stigma by keeping the nature of a person's illness secret. The need for similarly place additional stress on the family system because there is always the fear that the truth will be revealed. Nurses in the community is a key position to monitor community attitude and help in fostering a realistic attitude towards the mentally ill person. And for some patients, the emotional climate of the family to which they return can have a significant effect on their adjustment and eventually recovery from the debilitating effect of chronic mental illness. Families sometimes view mental illness as a weakness of character that can be overcome by exertion of moral effect. This type of familial attitude may result in guilt on the part of the patient who believes that he has disappointed his significant others, and guilt leads to increased anxiety and decrease the self-esteem. These are conditions that interfere with a high level of functioning. Therefore, nurses working with the family needs to foster healthy attitudes towards the mentally ill member. So this was about the tertiary prevention. So here we are concluding our topic. So in level of prevention in psychiatry, in primary prevention, we work towards reduction of the incidence of a disorder. In secondary prevention, we work towards reduction of the prevalence of a disorder. And in tertiary prevention, we work towards the reduction of disabilities associated with the disorder. So this was about the level of prevention in psychiatry and role of nurse in the psychiatry. Thank you.